Hello everyone, I am Pavitra Reddy. I am the host for today's event and I welcome all of you to today's webinar on health and wellness in advancing age. There are several factors that influence healthy aging and some of these such as genetics are not in our control. Taking care of our physical and mental health are within our reach though. We will hear from a speaker on various ways of managing health and wellness as we age. Before I introduce our speaker for today, I would like to give you a brief on Gaya Vikas, a registered trust with a dream to build and strengthen an ecosystem for seniors that empowers the seniors to lead a productive and meaningful life. We are a community of senior citizen members enabled through an online platform with a focus on a wide range of services starting with legal, financial, health and wellness. I request all of you to register with the Vaya Vikas in case you have not yet done so. Moving on, I would like to go over a few aspects of how to participate in today's event. It would be a 30-minute session on the topic, followed by question and answer session with Dr. Devi Shetty. You will have the opportunity to submit text questions to today's presenters by typing your questions in the chat window. You may send in your questions at any time during the presentation. We will collect these and address them at the end of the session. I request each one of you to mute your devices once we start the session. Without further delay, I would like to introduce the speaker for the session today, Dr. Devi Prasad Shetty. He is the founder chairman of Narayana Health, a renowned cardiac surgeon. Dr. Shetty has contributed enormously to the health policy initiatives with his ingenious ideas to make quality healthcare safe, affordable, and accessible to all. He was the past governor of the Medical Council of India and current chairman of the Board of Governors at IIM Bangalore. A strong advocate of technology applications in healthcare, Dr. Shetty also has a US patent registered as an inventor. He is also one of our board of directors of Vaya Vikas. Dr. Shetty, a warm welcome to you and over to you, sir. Sir.
Thanks, Pavitra. Thank you so much. I'm extremely grateful to Vaya Vikas for creating this platform for me to participate in this discussion. Obviously, as a doctor, I can only talk about the health. I want to start off with the good news for all the participants. The good news I want to give you is that all of you are going to celebrate the 100th birthday and prepare for your 100th birthday celebration now. None of us have any control over how long we are going to live, but we have immense control over how we are going to live. Health sciences, the greatest advancement in healthcare is the understanding that people can control their own health condition rather than depending on doctors like us. Today, with the knowledge what is available in the cyber world and the technologies of all the gadgets what you all have, most of the health problems can be managed at home by the patients. Now, I thought I would like to cover few interesting things you may like to know and hear. The first thing is, of late, there has been a lot of media coverage and a lot of sadness around young people, young, fit people with excellent physique, very, very athletic in nature, suddenly dying due to so-called sudden cardiac arrest. And it always gets presented that somebody who's so fit, a gym instructor or a film actor or a singer with six packs and big muscles, always stood an example for a healthy person, suddenly dies in the gym or on the stage or somewhere. And the discussion lasts for a couple of days and life goes back to normal. Now, is this a sudden cardiac event? Almost all these so-called sudden cardiac deaths could have been anticipated at least 10 years earlier if all those people went for preventive checkup, preventive cardiac checkup. Virtually all those deaths could have been anticipated and most of the time prevented. It is possible. But because they had no knowledge that they had a existing heart problem, they all succumbed to it. The most of the problem with the heart starts off at a young age. It may start at the age of 10 years or 20 years, much earlier than that. And simple blood tests, a simple ECG, a echocardiogram, and a CT scan of the heart could have shown clearly even 5% blockage in the heart can be detected today with these technology tools. Large number of people in India and outside India, they draw conclusions about their fitness based on how they feel. If you're feeling fit, if you're feeling fine, you feel you're a fit person. But reality is different. You may stand in front of me and say that, look, Doc, I climbed Mount Everest 3 times in the last 1 month. I'm a fit person. I will congratulate that person, but I will tell him that unless he comes up with a blood test, a ECG, echocardiogram, and a cardiac CT scan, I won't tell him. I will tell him that I cannot say you're a fit person. It is very, very important, especially senior citizens, to go for a preventive checkup. I know why people have a mental block about going in for a preventive checkup. Because the common saying is that you go to doctors, get the test, some tests done, they will find something, and then you had it. But the reality is, I don't think any doctor would like to do something what is not required to be done. And interesting thing today, or the good news is that early disease, if it is any disease, even worse form of disease, if it is detected early, we can cure them. Even if you can't cure them, we can give meaningful life. Today, people with heart disease celebrate the 70th, 80th, 90th birthday. People with cancer live to celebrate 80th and 90th birthdays. People with cancer live to celebrate many years. They live long enough to get second cancer, and they outlast that as well. All these happy endings happen if the disease is detected at an early stage. When the disease gets detected at a late stage, it doesn't matter how much money you spend. It doesn't matter which doctor you see. There is very little they can do to give you back the life you wish to have. This is the reality. So it is very, very important, irrespective of how old you are. At least once a year, get these tests done, and a CT scan be done once in 7 years or once in 10 years. You don't need to get it done every year. In fact, we don't advocate it even once in 5 years. The other advice I have is that if you suffer from chronic disease like diabetes, hypertension, it has to be treated aggressively by yourself. Today, even kids with diabetes manage their diabetes by themselves. You have enough gadgets at home. There are today gadgets which will give you the real-time blood sugar. The moment you eat, it will show you what your blood sugar is. So all these gadgets are available. Please use those technology tools and monitor your blood sugar, because diabetes is a real silent killer. We see thousands of patients with kidney failure, and most of the time it is a diabetes which is responsible. We see so many patients with a brain stroke, heart disease. It is a dreadful disease, but you will not know it. And when the blood sugar is 300, 400, you may not even know. Only the gadgets will tell you what the sugar is. And it is very convenient to forget the blood sugar level, blood sugar management. So, like us, there are many hospitals. We have an online diabetes program. Many hospitals have. I'm not saying you should be coming to our hospital, where doctors will see you just once a year and enroll for the online program. They will have all your diabetes data, and there is a team of nurses who are trained to manage diabetes and a group of doctors together. They manage your diabetes virtually online. So every time the blood sugar goes up and down, you do not need to see the doctors. And our doctors have presented the data wherein they have shown that the patients whose diabetes was controlled by doctors online had much better glycemic blood sugar control than patients who wanted to see the doctors personally. Because seeing a doctor today is not a very happy experience, and it takes virtually whole day. Whereas if a doctor and his team knows your trend of the blood sugar, how you respond to the various treatments, all you have to do is in your WhatsApp, send them a message about your blood sugar level. They will change or alter the medications, alter the dose, and you will be able to get their response in few hours. So essentially, these are the technologies which are available. Online is a great gift for most of the patients suffering from chronic diseases. Please use those technologies. And about a patient with hypertension, today there are very, very good quality blood pressure apparatus available in online. You can buy any of those. And there are today blood pressure apparatus online. You can buy it, which with the Bluetooth, it gets synced with your mobile phone. There is a record of your blood pressure. And my advice for people who are recording blood pressure at home is that, first of all, you should record the blood pressure every day at the same time. And you should sit on the same chair, resting your hand on the same table every time. Because essentially, when you are checking the blood pressure, you are just looking at the trend. One figure doesn't make much difference. We want to see the trend. And before you switch on the blood pressure apparatus, you have to relax for at least 20 minutes. You run around the house, you scream at the maid, then come back and check your blood pressure. That is not your real blood pressure. It is very important that you need to relax, then check the blood pressure. Now, never ignore, first advice I have is do not totally depend on the medicines. There are other things you can do to reduce your blood pressure. First of all, if you are overweight, just losing 5 kilos of weight will bring down your blood pressure. It will also bring down your blood sugar. Losing weight is the best healer, best form of treatment for most of the chronic diseases. If you're obese, you lose weight, you will have a massive transformation, especially past the age of 60, 65. So try to reduce weight and you have to exercise. The patients who are exercising, go for a brisk walk and active, their blood pressure is much better controlled than the others who do not exercise. And I just want to talk to you about a favorite topic of mine, that is yoga. According to me, yoga is the best gift given by India to the world. I can talk about my personal experience. Many years ago, I started getting pain in my knees. And I'm one of those exercise fanatics who did all the bodybuilding, karate, and all kinds of things at a young age. So I continue to do exercises, and pain somewhere in the body was virtually like accepted thing for me. And I didn't care. So it gradually got worse. And as a surgeon, I need to stand for long hours. And then it was becoming difficult. Then I became conscious when I was climbing steps or coming down from the steps. That is the time I realized that, something is going out of control. And my wife kept on telling me to get a good yoga instructor and go through the yoga exercises. And I thought a fit person like me, yoga is not meant for a person who's like me. But it went to a level that I couldn't stand for a long time. I couldn't climb stairs. I was choosing which leg to put first when I am climbing stairs. That's the time I decided that, okay, let me try yoga. And my wife got a good yoga instructor. And I think in 2 months or 3 months, the pain completely disappeared. Today, if you ask me, was it the right leg or the left leg? I can't even remember. All I did was exercises meant for taking care of the joints. And after that, every second day, alternative day, I practice yoga for at least 1 hour. And I feel that there are days goes by without me having any pain in any part of my body. And that experience I started experiencing only after I went past the age of 50. So essentially, if you're not into yoga, I strongly recommend all of you. You don't need a personal instructor. You can go through internet. There are very, very good videos teaching you how to exercise, or there are teachers who will teach you online. But I personally feel that it is good to be a bodybuilder. When you're a young, you can show off your muscles, six packs. But to be fit and healthy, it is very, very important for us to have all our joints functioning in a balanced state. And that can be accomplished only with yoga. So this is my suggestion. And the next suggestion I have is about taking care of the cost of healthcare, which is every day increasing. My suggestion is everyone should cover themselves with a health insurance. It doesn't matter how much money you have in the bank. As I said in the beginning, if you're going to celebrate the 100th birthday and even if you have a fairly large bank balance, you shouldn't take a chance. And having a health insurance for a long period of time gives you a lot of benefits out of the scheme. And also it will teach you how to deal with the health insurance companies. So this is what I have to say, and I'm looking forward to answering all your questions. Pavitra, over to you.
Thank you, sir. That was a very informative session. I already have a couple of questions in the chat. I'll just open it for you. So this is from Mr. Rajkumar Duggar. Question is, based on technical advancements and research going on, what are the new possible better options of treatment for various heart-related problems we can expect during the next, say, 10 years, especially to clear blockages in arteries?
Okay. First of all, large number of new technology tools have come up. Things which have been thought unthinkable or not possible have become a reality today. One thing is people who develop severe heart failure in which heart gets completely damaged. In good old days or even now, the only treatment option is a heart transplant. Today, artificial heart results are as good as a heart transplant. The problem is the high cost of the artificial heart, but it's a matter of time before it comes down. The price will come down. So that will be a boom, and it will become a large number of people who live long enough. If they develop heart failure, most of them may live with an artificial heart. That is the ultimate thing. And in terms of blockages, lifestyle modification is much better, gives much better results than any of the technology tools what is available, whether it's a stent or a bypass grafting or any one of those. There are today research papers getting published from the Western, especially European countries, where they have a methodology to reach each and every individual. Changing the diet, exercising, and lifestyle modification has brought down the incidence of coronary artery disease in those countries significantly. Even if they are not able to eliminate it, instead of people developing heart attack at the age of 50 or a blockage at the age of 50, if it can be postponed to the age of 70, that is something we should really look for in a country like ours, rather than new technologies to prevent the blockages. Now, we are definitely more knowledgeable for managing coronary artery disease compared to what we were 20, 30 years ago. In good old days, when I say good old days, 20 years ago, 30 years ago, every time we saw a blockage, we thought we have to open it up or do a bypass grafting. But today we don't draw conclusion based on one blockage. We look at the entire picture of the heart. Then we first ask ourselves, is it required to intervene? Then we ask the second question, if we need to intervene, what needs to be done? Is it an angioplasty or a surgery? So that kind of understanding we have reached because we have noticed that not all the blockages needs to be opened. So a lot of things are changing and happening. It's a very exciting area. On the whole, the management of heart disease has reached, I wouldn't say the total maturity, but it is much, much better today than it was maybe 10, 20 years ago.
And I think also it's reduced the hospitalization time itself. People are staying less time in the hospital
Yes.
and going home much earlier now.
Yes.
So another question from Mr. Thomas Verghese. Do you have a field staff who can visit elders in their homes with portable devices at affordable costs?
Can you repeat, Pavitra?
He's asking if you have staff who can visit elders in their homes with portable devices at affordable cost.
We are in the process of launching home health with our staff to cover people at home. Right now, those services we are not offering, but we'll be offering it soon. It will become a major activity for us. Yes, it will be affordable, certainly.
Yeah, and just to add in here that Narayana Hridyalaya is offering a coronary test, which is at a very affordable rate for Via Vikas members. If anybody is interested, can please contact us and we'll arrange for the same. This is only available to Via Vikas members, thanks to Dr. Devi Shetty.
Thanks. Yeah, I think, Pavitra, I'll explain to them.
Yeah.
All the tests I have been talking about, this is the chest X-ray, ECG, all the blood tests, ultrasound, then carotid, the CT angio, everything costs about 30,000 rupees for the test. But I think it is offered for, how much is it?
6,500 rupees.
Yeah, 6,000, including the pickup. Somebody will,
Yes.
the chauffeur will come to your house and pick you up and drop you back. Yes.
Yeah.